For our evidence synthesis presentation, we will be discussing concussion interventions. Here we have listed our objectives for this presentation. According to the Center for Disease Control and Prevention, otherwise known as the CDC, as well as Harris et al. In 2019, a concussion can be defined as a type of traumatic brain injury, or TBI, that is caused by a bump, blow, or jolt to the head, or a hit to the body, which causes the head and brain to move rapidly back and forth. This sudden movement can cause the brain to bounce around or twist in the skull, creating chemical changes in the neurotransmitters. It is important to note that a concussion is a form of a mild traumatic brain injury, or MTBI. It is typical for there to be a gradual remission or resolve of symptoms within 10 to 14 days of experiencing a concussion. However, if it goes beyond this, it is possible for someone to experience prolonged recovery. Post-concussion syndrome, or PCS, can be defined as experiencing persistent symptoms of an MTBI for longer than 3 months, as by the DSM-5 criteria, with additional psychosocial sequelae.
According to Chong in 2002, mild traumatic brain injuries, or MTBIs, account for at least 75% of all TBIs in the U.S. Youth injuries are the most commonly reported. Developmental changes also occur during adolescence, where there is an increase in both gray and white matter. Both types of matter play a crucial role in the development of motor skills, problem solving, language, abstract thinking, and social and emotional skills. Physiological changes can occur after experiencing a concussion. Some examples of these changes are neuronal depolarization, release of excitatory neurotransmitters, and changed metabolism. These are all due to decreased blood flow, axonal injury, and/or neuroinflammation. When assessing concussions, brain damage is not always evidently shown on a CT scan. Also, assessments generally lack the ability to determine the severity of an individual's concussion. Secondary issues can also arise, especially in youth who have slower recovery rates. Depression, anxiety, and deconditioning are all secondary conditions that may arise. Finally, post-concussion syndrome, also known as PCS, is a potential consequence of a concussion, and this condition is known to significantly impair the health-related quality of life and functional independence of patients with TBI. Research uses these OT strategies and interventions in both clients who are concussed and clients that have PCS.
Following a diagnosis of a concussion, there are various occupations and areas of occupational performance that are impacted. The first occupation that we chose to investigate is education. Concussions may lead to difficulties with mental and cognitive functions, as well as physical functions in relation to education. Examples can be seen here on our slide. Some general interventions that may be implemented in terms of education include adaptations and accommodations made to the environment. This can be changing the position of the individual in order to limit the effects of changes in light or artificial light, as well as removing or replacing certain materials on the wall that may be seen as distracting or that may lead to headaches, including posters with a lot of words or bright colors. There is also a Return to Learn program, which is a protocol that parents may follow in terms of returning their child to school after a concussion. This is a 4-step program, beginning with taking a break from cognitive activities, including school, in step 1, then moving into step 2 with a focus on some light cognitive activity, which could be about 15 minutes of work, and returning to some activities that don't cause their symptoms to worsen. Then step 3 is increasing their school-specific activity, like doing work at school as well as doing some work at home. And then step 4 is allowing them to fully return to school when they are able to do 1 hour of homework at home for 1 or 2 days, and also creating a modified schedule, which could include decreased class time, going to class for shorter periods of time, being given breaks to walk around the classroom or around the school if they need a little bit of a brain break, as well as adjusting the amount of notes or reading that they may need to partake in, as well as being provided with extra time on exams or assignments. The next occupation that we looked at is ADLs. ADLs are mainly impacted by concussions in the sense of dressing and feeding, and some general interventions include focusing on underlying client factors for the specific individual, looking at performance skills, as well as performance patterns that may affect their engagement in ADLs. Some examples include decision-making and judgment, which could make it hard for them to choose the clothes they want to wear or the meal that they may want to eat or prepare. Another occupation that we chose to focus on is rest and sleep. Concussions may lead to difficulties falling asleep, as well as a decreased length of sleep and a poor quality of sleep, especially if the area of the brain that is damaged is the hypothalamus and surrounding areas. General interventions should focus on preparation for sleep. This can be done through limiting the use of technology after a certain time in the evening in order to avoid headaches and wakefulness. In addition to this, limiting screen time in general may have a more positive outcome on rest and sleep. The same goes for reducing the amount of time that someone sleeps during the day. It is important to involve the parents of children when educating about rest and sleep protocols following a concussion. This is very crucial for the parents of those young athletes who may have a concussion as a result of their sport.
Social participation is next with the continued impacts of occupational performance. Feelings of isolation are really common and can lead to depression and anxiety. Decreased emotional regulation may also occur from frontal lobe damage. And decreased balance and a decreased amount of time spent on cell phones and electronic devices may also occur. And this is all really important with social participation because the individual must be able to attend to what others are saying. And therapy could focus on social interactions, appropriate behaviors for different situations, and counseling specific to the occupation of social participation. And this can include how to manage new social situations, appropriate behaviors in specific situations, and where there may be concerns. Next is work, and there are persistent symptoms related to vision following a concussion that can make it difficult for return to work and participate in work once returned. And finally, for IADLs, communication management is a subdivision within the IADL occupation in the OTPF4. So communication management can be impacted by the limited use of electronic devices, and cell phone usage significantly relies on one's ability to understand themselves, their behaviors, and consequences. We also have some approaches that are commonly used with concussion interventions, and these are create and promote, establish and restore, maintain, modify and compensate, and prevent.
Here is a quick overview of the interventions that we will be discussing further in depth. It is important to note that there are no in-depth assessments or interventions that should begin before the symptoms of a concussion are subsided, as they can exacerbate symptoms that were resolving or increase the severity of current symptoms.
Next, each of the interventions will be discussed in more depth. According to Hunt et al. In 2019, metacognitive strategy training approaches foster functional change by promoting self-awareness, self-monitoring, performance adjustment, and generalization and transfer to other tasks and contexts in everyday life. Co-op is an approach that falls under the category of metacognitive strategy training, and it focuses on the global strategy that is taught to the client. This global strategy consists of the goal, plan, do, check process that we discussed when learning about the cognitive frames of reference during lecture. Guided discovery is also a crucial component in using the co-op approach as a concussion intervention. Guided discovery facilitates problem solving through a client's ability to plan to achieve their goals, as well as evaluate their progress. This guided discovery means that the therapist is often asking questions that facilitate the client's development, rather than telling or suggesting any answers to them. After the therapist observes the client perform the tasks, the therapist frequently gives feedback. Next, positive reinforcement education can be used with post-concussion syndrome. This intervention includes focusing on finding solutions, brain plasticity, acceptance of diagnosis in order to complete emotional status in relation, as well as self-efficacy skills, and celebrating small victories as they are all a part of the same desired outcome and will allow for motivation on the patient's end.
Next, we will be looking at an active intervention approach that used submaximal aerobic exercise and body awareness therapy. For submaximal aerobic exercise, it is important to note that this should only be done following a thorough examination and assessment in order to assure an individual's safety and to determine whether or not they would qualify for use of this intervention. For the submaximal aerobic exercise, there were 8 individual sessions performed over 4 weeks. These were 2 sessions a week for 15 minutes each. This was done on a stationary bike, and during the first session, the individual's baseline heart rate was taken, and each session they worked to steadily increase by 10 beats per minute. This, as you can see, was found to be a successful intervention in improving cerebral blood flow and reducing the symptoms of post-concussion syndrome, as well as increasing exercise tolerance. For body awareness therapy, this took place over 6 practices with 2 a week over 3 weeks, and each session lasted for 45 minutes. There was a main focus on performing movements with a physical and cognitive presence in order to work towards mindfulness with a focus on breathing freely and moving energy economically. The goal was to have flowy movements, and each session ended with a brief body scan lying in supine on the floor. These sessions were done in groups as opposed to the individual sessions that were done for the submaximal aerobic exercise. Therefore, at the end of each session, there was a short group feedback session. This intervention was found to be successful in lowering sympathetic activity. There are also interventions that were done with gentle strengthening exercises and stretching, which was found to reduce cervicocoagenic symptoms when provided to the deep neck flexors and postural muscles, and manual treatment, which was found to improve cervical alignment and reduce muscle tension in individuals post-concussion. Next, we have some additional interventions that were provided following an evaluation using the top-down approach to help identify strengths and limitations for an individual post-stroke. These additional interventions provided following this evaluation include coping strategies, environmental adaptations, activity modifications, education plans, and lifestyle changes. Lastly, we will be looking at vision-related interventions. In lecture and lab, we have previously discussed and practiced vision-related interventions and our roles as OTs in this area. And a lot of these are very similar, except with the lens of looking specifically at someone who has experienced a concussion and the effects that their concussion has had on their vision. As an OT, we would begin with assessments of performance skills related to vision. This may include assessing visual, perceptual difficulties and vision as a whole, assessing cognitive and sensory processing skills, and assessing the ability to complete activities related to self-care, work, school, leisure, and play. I have listed some examples of interventions that OTs may participate in terms of concussion protocols. These would all be focused specifically on occupations that are impacted.
Next, we are going to review the levels of evidence for each research article Julia and I found for this presentation. So first is titled Management Strategies for Post-Concussion Syndrome After Mild Head Injury, a Systematic Review. And I classified it as a Level 1 descriptive study due to it being a systematic review. Next is Feasibility and Effects of the Co-op Approach in Post-Concussion Rehabilitation. And this one was classified as a Level 3 descriptive study because it was a case series. Next is Clinical Practice in Occupational Therapy for Treatment of Concussion in Schoolboys, an integrative review. This one was a little challenging to classify, so we considered it a Level 2 study because it is an integrative review. However, it's not listed in the pyramid that we referenced to classify each of the levels of evidence, but it's also not a systematic review, so we took a couple steps down and we would guess that it would be about a Level 2. Next is An Active Approach in the Treatment of Post-Concussion Syndrome, Evidence-Based Practice in a Collective Case Study. This was a Level 3 descriptive study because it was a collective case study. Next is Concussion-Related Vision Disorder Practice Patterns in Occupational Therapy, and it was a Level 3 descriptive study based on a survey. And finally is the addition of occupational therapy to an interdisciplinary concussion clinic improves identification of functional impairments, which was a Level 2 outcomes research or observational study, and it was classified also as a cohort study.
Here we have our implications for OT practice. It is important to note that OT should be included in interdisciplinary treatment teams for concussion interventions and initial evaluations, as they allow for more specific analysis and a deeper understanding of the impact that the concussion has on occupational performance in various areas. Here we have 3 future study ideas, all of which were inspired by some of the articles that we synthesized for this presentation. Here are our 4 discussion questions.
And finally, here are our references, and thanks for watching.